Hi friends. Welcome to our channel Global Health Helpline. Today we will learn about the physical state and soreness of the remedy Arnica Mont from the book, Lectures on Homeopathic Meteria Medica by James Tyler Kent. Please see the first part of this video. The link is given in the description box. Please subscribe our channel to be connected with us. Let's begin. Physical state. Now, with this mental state thoroughly in mind, we are prepared to take up the general physical state, which has in all complaints, LL over the body, a feeling as if bruised. It is not strange that arnica is used for bruises, but it is very foolish to put it on the outside and to rub it on in the form of the tincture. It produces in its pathogenesis mottled spots, like bruises. If you take arnica internally, in large doses, you will have mottled spots, bluish spots, which become yellowish, due to ecchymosis, from extravasations of the smaller capillaries. This is, to a certain extent, what takes place in bruising. It is an extravasation of blood from the capillaries, and sometimes from the larger vessels. But all over the body he is sore and bruised, as if he had been beaten. If you watch an arnica patient in order to get the external manifestations of his state, you will see him turning and moving. You will at once ask yourself, why is he restless? And if you compare remedies in your mind, you will say, he is like RHU's tox, he stays in a place a little while and then he moves. No matter if he is only semi-conscious. You will see him make a little turn, part way over, and then a little further over, and so on until he is over on the other side. Then he commences again, and he will shift a little, and so he turns from side to side. The question is, why does he move so, why is he restless? It is an important matter to solve. We notice the awful anxiety of the arsenicum patient that keeps him moving all the time. We notice the painful uneasiness felt all over the body with the RHU's patient so that he cannot keep still. The arnica patient is so sore that he can lie on one part only a little while, and then he must get off that part or to the other side. So if we ask him, why do you move so? He will tell us that the bed feels hard. That is one way of telling that the body is sore. A more intelligent individual will say it is because he is so sore and feels as if bruised and beaten, and he wants to get into a new place. Soreness. This state of soreness is present if it be a symptomatic typhoid, an intermittent fever, a remittent fever, or after an injury when he is really bruised all over. You get the same continual uneasiness and motion, moving every minute. He moves and thinks that now he will be comfortable, but he is comfortable only for a second. The soreness increases the longer he lies, and becomes so great that he is forced to move. With RHU's tox, the longer he lies the more restless he grows and the more he aches, until he feels as if he will leave if he does not move. With RHU's tox, the uneasiness passes off after moving, and with arnica the soreness passes off if he gets into a new place. With arsenicum you see him moving about and look wild, and he is anxious, and this anxiety forces him to move, and he gets no rest, for he keeps going. The RHU's tox, and arnica patients get better from every little motion. The arnica patient bleeds easily, his blood vessels seem to be relaxed, and extravasation is easy. Blue spots come easily upon the skin, and internally the mucous membranes bleed easily. The parts that are inflamed bleed. He is subject to catarrhal conditions, and if he has a cough he bleeds easily. The mucus that is hawked out of the chest and throat is streaked with blood, or dotted with tiny pinhead blood clots. His urine contains blood and there is bleeding from the various orifices of the body. There is not sufficient tone in the fibers of the vessel to hold the blood within the vessel walls and they ooze. All over the body there is a lameness, and soreness, and a feeling as if bruised. A rheumatic lameness, the joints are swollen, sore and lame. If an acute disease becomes more severe, we shall find the mental symptoms as described, and there will be an increasing soreness in the muscles. Arnica is very suitable for that sore, bruised condition of the body, therefore arnica is a very important remedy in injuries, bruises and shocks, injuries of joints, injury of the back with lameness and soreness. In such conditions arnica becomes one of the first remedies, and unless there are general decided symptoms calling for other remedies it should be the first remedy. Arnica will very often take all the soreness out of a sprained ankle and permit him in a few days to go walking about to the surprise of everybody. The black and blue appearance of sprained joints will go away in a surprisingly short time, the soreness will disappear, and he will be able to manipulate that joint with surprising ease. I have seen a sprained ankle when it was black and blue, so swollen that the shoe could not be put on, but after a dose of arnica, the swelling disappeared in an astonishing way, the discoloration faded out and the patient was able to stand on the foot. No such result can be obtained with the use of arnica lotion externally. A high potency of arnica is most satisfactory in bruises, and when no decided contraindication is present, arnica is the first remedy. But for the weakness of tendons that follows such a condition, arnica is not always sufficient, and the RHU's tox is its natural follower. If the weakness and tenderness remain in the joints, follow the RHU's with calcarea. One will not, of course, give these remedies all on the same day, and not in the same glass, but will wait until all the good has been gotten out of the arnica before following with RHUs. It is quite a common thing for aching and restlessness and weakness to come into a part that has been injured. An RHUs is then a suitable remedy, and it is quite common for a joint that has been badly treated to remain sore and weak, and then calcarea comes in as a natural follower of the RHUs tox, and then we have to resort to causticum, Staphylos aureus, and other remedies, because of some peculiar feature in the case, but these remedies are all related more or less to arnica, RHUs and calcarea. For another class of injuries, compare ledum and hypericum. Arnica is useful in some chronic cases, especially in old cases of gout. It is quite a common thing for old cases of gout to rouse up into a new soreness of joints, with great sensitiveness. You will see the old grandfather sit off in a corner of the room, and if he sees little Johnny running TOWA. RDS him, he will say, "Oh, do keep away, keep away." Give him a dose of arnica and he will let Johnny run all over him. He does not want to be touched or approached, he feels that anything that is coming towards him is going to hurt him. He is extremely sensitive, his joints are sore and tender, and he is afraid they will be hurt. This medicine has erysipelatous inflammation. If you have an erysipelas of the face with the mental state described, with soreness, and sort bruised feeling all over the body, you need not wait longer BEF. Or prescribing arnica. The sore, bruised feeling all over the body, and the mental state, would decide in favor of arnica against any medicine. In inflammation of the kidneys and bladder, of the liver, and even in pneumonia, the mental state and the sore, bruised feeling all over the body would enable you to do astonishing work in such cases, even though arnica has never produced pneumonia. It has all there is of the rusty expectoration, with all the soreness of the chest and catarrhal state, the coughing and gagging, and sore, bruised feeling all over the body, and then add to this the condition of stupor and the mental state that belongs to the inflammatory condition of any organ and is especially strong in this medicine. We do not have to worry about any particular fineness of diagnosis to settle upon arnica. Arnica has aversion to meat, broth and milk. There is great thirst at particular times, for instance, during the chill of intermittent fever he has thirst, while at other times he is thirstless. Vomiting of dark red coagula, mouth bitter. General soreness. Vomiting of black, inky substances. Arnica is a useful remedy in inflammatory conditions of the abdomen, liver, intestines, with tumefaction tympanitis, prostration, tendency to uneasiness, and so sore that he cannot be touched. This state also comes with typhoid. Do not forget the symptoms of arnica in appendicitis. You do not need to run for the surgeon for every case of appendicitis if you know bryonia, RHUs tox, belladonna, arnica and similar remedies. The homeopathic remedy will cure these cases, and, if you know it, you need never run after the surgeon in appendicitis except in recurrent attacks. If you do not know your remedies, you will succumb to the prevailing notion that it is necessary to open the abdomen and remove the appendix. It is only deplorable ignorance that causes appendicitis to be surrendered to the knife. Offensiveness is a feature of arnica, there is offensiveness of the eructations, and the flatus. The stool is horribly offensive. Nightly diarrhea. Stool involuntary during sleep. Stools of undigested food, purulent, bloody slimy, mucus, dark blood, very fetid stool. Here we see the tendency to oozing from the mucous membranes. Black watery stools with black vomit. Retention of urine from exertion. From overwork, from injury, from concussion of the brain, from some violent accident. The urine is brown, or inky, dark. Piercing pains as from knives plunged into the kidneys. Quote, urine very acid.